Hello, I'm Dr. Mary Ann Teitelbaum, and today we're going to talk about prediabetes and diabetes. 1 in 3 people in the United States have prediabetes, and as the name implies, your blood sugar incrementally goes up as the years go by. And up to 70% of individuals with prediabetes, they'll eventually develop diabetes. Doctors monitor your blood work, and then when it looks like you've developed diabetes, they give you medicine to lower the blood sugar. This is not the correct approach to take. It's more important to nip any disease process in the bud. The ancient doctors of India described 6 stages of a disease process that we go through as we work our way towards a disease that we could name. And in the first 2 stages, the imbalances are there, but there's no symptoms yet. By the second and third stage, you start to develop symptoms, like in this case, your blood sugars could start to become elevated. But since they're not in the diabetic range yet, it's not considered as diabetes. But by the 5th and 6th stages, enough damage has been done to the tissues and the physiology that you can now in fact name it as a disease, such as diabetes. Now, we don't want to just sit back idly through the years and just watch our blood sugars increasingly go up over time until we get diabetes. The ancient doctor said it's much easier to reverse the early stages of a disease process, but much harder to reverse it once you've progressed to the point where you can name it as a disease. So it'll be much easier and make more sense to try to reverse these various imbalances which are responsible for elevating the blood sugar before it's too late. You don't want to start trying to do something about it once you're diagnosed with diabetes. And you don't want to suppress the symptom of diabetes, which is the high blood sugar, by just bringing down the sugar using a pharmaceutical, and at the same time avoiding why the blood sugar is high in the first place. So let's take a look at what we can do in the early stages of a disease process. And if in fact it's too late and you've already been diagnosed with diabetes, you should still examine all the imbalances that led up to it, because these same imbalances could cause other diseases if you let them fester. Now, one usually thinks that the pancreas is the main problem with diabetes, since the pancreas makes insulin, which lowers the blood sugar. And while yes, at some point the pancreas does play a role in the development of diabetes, the initial culprit lies in the liver. And as I've stated before in many of my videos, the liver is at the root of so many disease processes because it has hundreds of functions in the body. So if the liver becomes corrupted, almost any disease could result. And just about all my pre-diabetic patients present with a liver which is ailing. And sure enough, research is bearing this out. New studies are showing that people with a fatty liver disease are much more likely to develop diabetes within 5 years than those with healthy livers. So if you notice that your blood sugars are starting to go up, this should send an alarm to start taking better care of your liver. Many people have what's called non-alcoholic fatty liver disease, which means that they don't even drink alcohol, but yet their liver is fatty. Consuming alcohol causes most of the fatty liver disease that we hear about, but with non-alcoholic fatty liver disease, the same thing can happen even without drinking the alcohol. So what would be causing this situation then if you're not drinking alcohol? Well, a large cause are the bad fats that we consume, like the vegetable oils, and the poor quality olive oils, which are processed using heat and chemicals and contain some vegetable oils in them, even though they're calling it olive oil. These types of oils cause a lot of liver damage because they form a poison when you cook with them and you heat them. And since everything you swallow has to be processed by the liver, they end up scarring the liver and it causes a fatty liver. Some of the research shows that a fatty liver is actually the greatest indicator for whether or not you'll develop diabetes. It's even more of a causative factor than the levels of insulin. So here's what you need to do if your blood sugars start going up and your doctor decides that it's okay to just watch the levels inch up each year. Start prevention now. First and foremost, give up the vegetable oils, which are canola, safflower oil, groundnut oil, which is known as peanut oil, sunflower, mustard seed oil, palm oil, and the cheap olive oils. Instead, use high-quality organic cold-pressed olive oil and use ghee made from grass-fed cows, just those 2 oils. Eat only good quality natural sugars like evaporated cane juice, date sugar, coconut sugar, jaggery, and maple syrup because the refined table sugars, artificial sweeteners, and fructose corn syrup and agave all damage the liver. And of course, give up alcohol immediately because it's highly toxic and very damaging to the liver cells. Plus, alcohol is converted into sugar once it enters the body, causing elevated blood sugar levels. Start on a program to reduce weight if you're obese, because obesity can also cause diabetes. This can happen because overeating stresses the membranous network inside the cells, which is called the endoplasmic reticulum. It causes it to process more nutrients than it can handle. So it sends out an alarm signal to the cell, telling it to dampen down the insulin receptors on the cell surface, which causes insulin resistance, which then causes the blood sugar to go up. And another reason obesity causes diabetes is that when you're obese, excess fats drain into the portal vein, causing excess fatty accumulation in the liver, which also results in insulin resistance. See, the portal vein normally carries nutrient-rich blood from the digestive tract to the liver, so you don't want too much fat being dumped into the liver at any one time, which could cause a fatty liver. Exercising also helps to bring down blood sugars. When you do moderate exercise, your muscles work harder and they use more glucose, which can lower your blood sugar. And there are many herbs that nature has given us to clean the liver, regenerate liver cells, and other herbs to cool down the heat in the liver, because it turns out that the liver actually overheats when it's holding on to lots of toxins and poisons. And then when it overheats, it gets kind of angry and it can't control the blood sugars. Many people will tell you that they brought their blood sugar down by eating Karela, and it's also known as bitter melon or bitter gourd. They ate it several times a week. And that's because the bitter taste is good for both lowering blood sugar, whereas the sweet taste can increase it, and at the same time, the bitter taste pulls the poisons out of the liver, which will then allow it to control the blood sugars better. A January 2011 article published in the Journal of Ethnopharmacology showed that a 2,000 milligram daily dose of bitter melon reduced blood glucose levels similar to metformin, which is the main medicine that is used for diabetes to lower the blood sugar. It also protects the beta cells of the pancreas, where the insulin is made. Even Sloan Kettering posts the benefits of eating bitter melon on their website. They claim that modern research shows that the substances in bitter melon act in the same way as insulin by increasing the entry of glucose or sugar into the cells and promoting its processing and storage in the liver, muscle, and the fat. They also state that bitter melon prevents the conversion of stored nutrients to glucose and the release of this glucose or sugar into the blood, which helps the blood sugar maintain itself within normal limits. In fact, reductions in blood sugar after taking bitter melon can be seen as quickly and as soon as 30 minutes, with the greatest reduction occurring at 4 hours and lasting for 12 hours. We also have many herbs which lower the blood sugar, like Gymnema sylvestre. It's also called Gurmar in Hindi, which means destroyer of sugar. It's perhaps the most famous Ayurvedic herb that's used for lowering blood sugar. Gymnema both stimulates insulin secretion and it can actually regenerate the pancreas cells which make the insulin. Studies have found that the sugar-blocking effects of Gymnema occur just 30 seconds after you put it in your mouth, and it lasts for 1 hour. Gymnema can even help to take away your sugar cravings because of its unique property. It turns out that the atomic arrangement of the Gymnema molecules is very similar to that of glucose or sugar molecules, and they can actually fill the receptor sites on the intestines, which prevents the sugar molecules from absorbing, which results in low blood sugar levels. And Gymnema is also famous for its ability to make sweet foods taste less appealing by reducing the ability to taste sweet. The active ingredients in the Gymnema do this by blocking the sugar receptors on the taste buds. And in study after study, people who consume Gymnema had less desire for sweets, which also helped to keep their blood sugars low. Now, Indian quinoa has also been used as a traditional medicine in Ayurveda for treating diabetes. It can reduce the symptoms associated with diabetes, like frequent urination, overeating, and a burning sensation in the limbs. It can also increase the insulin production in the pancreas. The leaves and bark of the guduchi plant play a major role in stabilizing blood sugar levels and controlling diabetes. It can increase the production of beta cells in the pancreas, again, the cells which make insulin, which results in good insulin and glucose levels in the blood. Ancient herbs and spices used for centuries in Indian cooking have the potential to control diabetes. For example, both turmeric and cinnamon stick increase your sensitivity to insulin. Remember, insulin lowers your blood sugar. If you become less sensitive to its effects, which is called insulin resistance, then your blood sugar will increase. It's also recommended to soak 2 teaspoons of whole fenugreek seeds in hot water overnight and drink the water in the morning. The seeds slow down the digestion and absorption of carbohydrates, which helps to keep the blood sugar low. And another good recipe to lower high blood sugar is to soak 4 to 6 medium-sized okra pods in water overnight. Cut both ends of the okra and slice them in half lengthwise, soak them in a cup of water overnight, and drink just the water in the morning. And it turns out that the fiber in the okra lowers the blood sugar by slowing down the absorption of sugar from the intestines. Scientists believe that the Indian curry leaf, which is an ingredient used in many curry dishes and in traditional Indian healing, may also contain agents that slow down the rate at which starch turns into sugar in people with diabetes. The curry leaves control the amount of sugar entering the bloodstream, and cooking with curry leaves are also beneficial for blood sugar because they tend to boost insulin activity, which also stabilizes the blood sugar. So as you can see, the best way to treat diabetes is to prevent it by not allowing it to progress from the pre-diabetic stage. But even if you do have diabetes, please try some of these suggestions, as you may still be able to reverse the damage to both the pancreas and the liver. I've been able to lower the diabetes medications in many of my patients by using these recommendations, and in some cases, patients were even able to come off their medications altogether. So I hope you learned how to properly manage high blood sugar by using all of the remedies nature has given us in the form of foods, herbs, spices, and plants, which are all famous for the prevention and treatment of diabetes, and they've been used for centuries in Ayurvedic medicine. Thank you.